Good afternoon, and thank you for joining in today. I just wanted to share some updates from this week with you and also take some time to answer some questions along the way. This week we have an updated epidemiological report of the COVID-19 cases in Montana. The report analyzes cases through May 1st. It's on the website covid19.mt.gov. I'd encourage you to take a look at it. Much of the information is certainly consistent with what we've shared over the last few weeks, but there's a few new things that I want to highlight. The first COVID-19 case in Montana was reported on March 11th. Since then, the number of new cases has climbed to 455 in 7 weeks. After reaching that first 100 reported cases within 2 weeks, well over 100 cases were reported each of the following 2 weeks. Since then, every week there have been fewer reported cases than in the previous week. The growth of COVID-19 continues to slow in Montana at this time. Over time, our positivity rate has gone down. The overall positivity rate for lab testing to date is 3.1%. From March 21st to April 10th, that positivity rate was 4%. It's been dropping by 1% in each subsequent week, and it's down to 1% in the most recent week. New this week, and I know that there's often been a lot of questions about how this works. New this week's a summary that includes some detailed information about contact tracing and local public health investigations. Just over 2,000 contacts were identified through case investigation and contact tracing, which highlights the work that the local jurisdictions have done to contain the outbreak in Montana. Close contacts of a COVID-19 positive case were placed into quarantine and monitored for symptoms daily for 2 weeks. If a close contact developed any symptoms of COVID-19, they were immediately tested. This process helped contain the COVID-19 outbreak because quarantined individuals that became cases were identified earlier in their illness and were already restricting their exposure to other individuals, which resulted in fewer new exposures. In Montana's 6 largest counties, 139 COVID-19 cases were identified as a result of contact tracing. An additional 80 cases were reported in other jurisdictions, resulting in a total of 219 cases identified through contact tracing. So what that's saying is about half of the cases, half our positive cases were identified through contact tracing. And in many cases then, that tracing helped to identify cases in smaller counties who likely were exposed to individuals in neighboring counties, thus reducing the potential for additional spread. As increases in reported COVID-19 cases occurred, there was contact tracing by local public health identified connections among cases with common exposures. This investigation then allowed for the rapid identification and quarantine of individuals considered exposed to prevent further spread. I'd really like to thank our local public health offices who are on the front lines of mitigating the spread of the virus. These results certainly show that their efforts to identify and quarantine have helped lead us to where we are today in our state. In an effort certainly to assist this work further, we made available through that first round of emergency relief grant funding, $5 million for local and tribal health departments and urban tribal clinics to help support contact tracing efforts. These dollars can also assist with overall efforts in response to COVID-19, such as in their work with local businesses to ensure that they follow reopening guidelines. Thus far, 41 public health offices have applied for these grants. Earlier this week on Tuesday, I announced the creation of 9 new programs, including the public health grants, to help with economic recovery from the economic fallout of COVID-19. These 9 programs join the state's suite of existing support services, as well as direct federal appropriations to ensure that we can begin both a short and long-term path to economic recovery. 15 minutes after the application portal for the 9 new grant programs opened yesterday, there were more than 2,000 people trying to start applications. As of this morning, 5,500 businesses had applied for the Business Stabilization Grant alone, with 150 applications already approved. Over 270 businesses have applied for the Food and Ag Adaptability Program, and 465 businesses for the Innovation Grants. Over 400 Montanans submitted applications for housing assistance. Over 600 nonprofits applied for social services grants. It's clear from the thousands of businesses applying for one program alone that Montana and Montana businesses need support getting through this difficult time. The agencies operating these grant programs have enlisted additional staff to review applications and get the funds out as quickly as possible. With the need for this economic relief clear, we're also addressing the need for the next round and what else might be needed in the future. As I've said before, this is just an initial round of funding based on the immediate needs identified by Montanans and small businesses. There'll certainly be additional funding announced in the upcoming weeks, and we'll closely monitor the demand for this first round of emergency grants to adjust as needed and ensure Montanans are getting relief. As we continue to navigate this public health emergency and keep Montanans safe, economic recovery for our Main Street businesses is certainly another of our top priorities. We're continuing to look for ways that the state can help fill unmet needs not addressed by the CARES Act or other federal funding going forward. Yesterday, I announced additional guidance under Montana's phased reopening plans. The guidance allows gyms and fitness studios, movie theaters, and museums to reopen beginning May 15th, and delaying that to allow both businesses and local public health officials time to prepare to ensure that guidance is being followed. The decision was made with input from public health to determine what types of social distancing and capacity and sanitation requirements must be implemented to allow these establishments to reopen while minimizing exposure. Gyms and fitness studios, movie theaters, museums must all keep their capacity at 50% or below, implement social distancing, and boost sanitation efforts. Some of these specifics include hosting group classes outside only at this point, offering hand sanitizer, managing customer flow, and training workers on these new requirements. I encourage all Montanans to thoroughly read that guidance posted on the website. Gyms and theaters and museums will be responsible for maintaining their capacity and sanitizing frequently, but Montanans also still have a role to play. Asking everyone to continue to stay at home if you're sick, frequently wash your hands, and pay attention to the policies implemented by these establishments. You can also do your part by wearing a mask. If you visit a museum, being sure to carefully wipe down your gym equipment immediately after you use it, and standing 6 feet away from the next customer when you're in line to buy your movie ticket. We're able to take these steps and this next step because Montanans have worked collectively together to follow the guidelines and indeed are continuing to remain cautious. We must continue this effort to keep Montanans healthy, and we must continue this effort if we want to stay open. We continue to have a low number of new positives, which does provide us with that opportunity to gradually reopen earlier than in many states in a way where we still have strict social distancing measures. But as it is everywhere else, the virus is still in Montana, and it will be here for a long time. We continue to work on ramping up further our testing capacity. This week we've been working on the logistics with long-term care facilities and had a nursing home participate in a dry run. The vast majority will be able to collect samples from their own residents, and we'll provide the support for those unable to do so. While we work with facilities to schedule out when testing will be taking place over the next several weeks, we also continue to work on obtaining the adequate testing supplies to assemble kits to provide to the facilities. I've spoken with members of the federal government, I think almost every day this week, and expect shipments this weekend that will help us reach our upcoming targets. As we strive to increase testing capacity, continue to get supplies both for testing and PPE, and with our ability to contact and trace, I believe we'll be able to quickly respond if we see an uptick of cases in a community. As always, as we head into this weekend, let's continue to do our part to contain this virus and slow any spread that could occur. We're not out of the woods, and every step that we take now and in the future will make all the difference along the way. So I'll now open it up for questions. If you have a question, please press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana.
Hi, Maritza.
I'm wondering, we went a few days without any new cases, and the national media was even talking about it, and then I learned of 3 new cases yesterday afternoon. I'm wondering if we see a big spike in numbers over the next week because of either increased testing or loosening restrictions or both. Would gyms and movie theaters still be allowed to open next Friday?
Well, I think, as I've said at every step of the way, we do expect to see more positive cases because the virus certainly hasn't left our country, it hasn't left our state, and it isn't realistic to believe that we'll have continuous days of no cases. I think since Sunday that we have 4 reported cases. The whole week before was 6. So we are in a relatively good place, Maritza, but believe like the 2 Montanans who tested positive yesterday and it was reported that they had traveled out of the state, and now then public health officials will work to identify any known contacts to eliminate any chains of transmission. So I don't anticipate those cases or the occasional cases to change the plans to open up movie theaters or fitness centers. But it also underscores again that as Montanans take care of this, that the transmission of this, while they were Montanans, they actually contracted the disease, my understanding is, in other states. Next phone question.
Hi, Governor. This is Nikki Willett from Yellowstone Public Radio. How's your Friday?
My Friday is doing pretty good, Nikki. How's your Friday?
Can't complain. Pretty happy. So you just mentioned that earlier this week you amended Phase 1 to include movie theaters, gyms. Moving forward, should we expect to see more businesses reopened under Phase 1 through amendments, or are you developing a timeline now to bring us into Phase 2?
So the question was, we added additional businesses to Phase 1. Do we anticipate bringing in additional businesses, or is it as we get to Phase 2? Each piece of this, and when we announced this, even said, none of this is written in stone. We want to see what's happening in our states and our communities. as businesses are also preparing to open, and it'll be a phased approach all the way along. I had a level of comfort in talking to local public health that as we've, even within phase one, sort of parsed things along, we opened up Main Street businesses, retail businesses before we did eating establishments and breweries and others. So phasing that along, had the confidence after talking to local public health that could certainly do this with movies, theaters, non-tactile museums, and fitness centers, as long as they are following social distancing and restricting the folks. As far as opening up additional categories of businesses right now, nothing planned, nothing in the works on that way, and we're continuing to monitor how this phased reopening goes as we look to what the prospects of going to phase two would be. Next question.
Yeah, Governor, this is Troy Shockley from the Montana Radio Company.
Hi, Troy.
And hi, you'd mentioned that those testing positive in Gallatin County had recently traveled out of state, and while Montana's done a great job to keep those numbers down, places are reopening now. How concerned should we be that summer travel may be bringing in people out of state, causing a spike? I mean, I know you have National Guard at airports, train stations, stuff like that, but most of the travel into the state's going to be coming by car, and that's obviously still wide open.
Well, so Troy's question was, these positives of this week came from Montanans that had traveled out of state. How concerned are you that additional transmission come from out of state, and that we have folks at the airports, National Guard still? So there still is the 2-week quarantine in place for individuals coming to Montana for non-work reasons. We're asking that they spend their first 2 weeks quarantining. I recognize, what all of this is we do have reader boards on the highways reminding people that are coming in, and we do have National Guard still at this point testing at the airports or reminding folks and temperature checking. I do recognize that there's no better place to be in America or the world than Montana during the summer. But I also encourage people's patience still at this point, where we're seeing where this phase one reopening and how it's going. So no plans or no announcements yet as far as lifting sort of that quarantine period for those that want to travel to Montana for vacation. We continue to talk to public health. We continue also to talk to local public health officials. And there are some communities and jurisdictions, and like our tribal nations, have even been more restrictive. Certainly, I support them in doing so, but we'll just have to continue to closely monitor how things are going as we look at this phased reopening. Next phone question.
Hi, Governor. It's Phil.
Hi, Phil.
I'm wondering, sir, I see in the map that Toole County still has about 7 active cases. Seems to be the high place in the state. Can you provide any kind of assessment as to what's going on in Toole County?
I haven't had an update. Jim, do you have any update? Yeah, you have to come up here. Jim Murphy of our Infectious Disease Division.
So thank you for the question. It was about the active cases in Toole County, which I think are still sitting at 7. I think what this illustrates is that it takes a long time in many cases to clear the virus. After somebody is identified as a case, we have been very cautious in settings of vulnerable populations like nursing homes and long-term care centers to do testing to see when somebody clears the virus, and in some cases that's been taken up to 4 and 5 weeks. The good news for Toole County is we have not had any recent cases in Toole County, well past an incubation period now. So we're optimistic that their outbreak is over, But we still have some people that are under isolation orders until they test free of the virus. So thanks for the question.
Next question.
Governor, this is Jonathan Amberian from Montana Television Network. I wanted to ask, do we know for the people who are applying, as you talked about, for these new programs that were announced this week, do we know when they might expect to begin seeing some of this money arrive?
Yeah, Jonathan, so even already that there's some of them, a small handful, that have already been cleared, as I noted in my statements, and we're working on it, we're assessing it, and so it will be in the upcoming weeks. Next phone question.
Hey, Governor, this is Olivia Iverson with NBC Montana. We received a question from someone closer to the Wyoming border because their governor actually lifted that 14-day quarantine restriction starting today. Can you explain your rationale, maybe why that's not a good idea and why we're not doing that here, even though our case numbers are better off than Wyoming?
Well, I think that that's one of that every single governor has to make their own decisions in consultation with public health as far as what might be best to both control the virus and contain the spread. I mean, I'd also point out it's within the epidemiological report on one of the last pages, it says COVID-19 case rates per 100,000 population. Montana is at 42. Wyoming's twice that. North Dakota is over 3 times that. South Dakota is over 6 times that. Idaho's at a rate population about 3 times more. So I think it is the steps that Montanans took that made us at this rate, and it's one of these that we want to make sure as we do a phased reopening that we can stay open. And even these cases most recently from Gallatin County sort of underscored now as Montanans have taken care of one another, we want to be careful that anybody that might come into our state is treating Montanans just like we've been treating one another to slow the spread. So every governor is going to make their own individual decisions. I want to make sure that the decisions that I'm making are best informed by how public health, how we can open, and how we can stay open. Next phone question.
Hi, Governor. This is Patrick Riley with the Missoulian. How are you?
I'm well, Patrick. How are you?
I'm good, thanks. So following up on the topic of people coming in from out of state, are you prepared to take any measures at this time to enforce that 14-day quarantine?
Patrick, we hope that folks will actually abide by it, and it's at the end of the day, this is a partnership that I've heard some local public health officials raising concerns with some folks from out of state, but we'll continue to both do what we can at the state level as will local public health, but no extraordinary measures to announce certainly at this time. Next phone question.
Hi, Governor. It's Marisa again, and I just got off the call with Missoula health leaders, and they mentioned there's a plan to possibly start sample testing healthy individuals to better understand cases that may present as asymptomatic. I'm wondering if you have any more information on that and when that may start.
Yeah, so Maritza, I think it was last week, had really said that I want to get us significantly greater expanded testing, and that has a number of different elements. One of which is, of course, our long-term care and our assisted living facilities, because we also know that those are often the most vulnerable populations, and we'll be testing for symptomatic and asymptomatic. Next week, we already have lined up, there'll be 19 long-term care centers, 3 assisted living facilities. That's 937 residents, 1,306 staff. We're looking to do our 2 state veterans homes and also some of the larger facilities where congregate facilities that the state has oversight, additional testing in places like Warm Springs. Looking at surveillance testing, which is doing symptomatic and asymptomatic. We'll probably be rolling out a more significant program starting with the Crow Nation, because we also said want to do each of our tribal nations. I anticipate that will start next week. And then we're working with local public health and community health centers to do a greater bit of surveillance testing, which is essentially what you said, your question, both testing of symptomatic and asymptomatic. I'm hoping to see some of that beginning next week at a greater level than it has been as well. And again, encouraging anyone, if they even have one of the COVID-19 symptoms, to get tested. Next phone question.
Hi, Governor. It's Patrick Riley with the Missoulian again. Are you has your budget office come out with any revenue forecasts yet? And if not, when do you expect those?
So Patrick, you know, I'm pleased that our state was in a historically strong position going into this. Our reserves, we had approximately $360 million in the general fund, $117 million in the budget stabilization fund, $55 million in the fire fund, and you know, we enter into that in a stronger position than most states. That doesn't mean though that we're immune from the impacts of the virus. We're continuing to look at what this does to state revenues, and you know, maybe one of these press conferences soon, I'll have a more in-depth discussion about that, but in regular contact with budget office, both where we are and how we're weathering this storm. Any more questions? Well, again, thank you for joining us today. Happy Mother's Day to all of those mothers on Sunday, and enjoy the weekend, but please, again, be cognizant of taking care of one another. Thanks so much.